That's Dolores. You can
I'm
say
Dolores Glenn. I contacted multiple myeloma 32 years ago, and they gave me 2 years to live, but I fooled them all, and I'm still here. I was in remission for, I guess about 20 years, and I was on chemotherapy for 8 years, and I was only on aspirin. That's all I was put on. And then after 8 years, I stopped taking aspirin, and I was fine up until this year. And I only have 10% multiple myeloma right now. And I'm doing very well. And the only thing that I'm on is they put me on a reader, and I take that once a month for 2 hours intravenously. That's my story.
Her story is she asked if she could help, and here she is.
And I read about Barbara in the newspaper, and that's how I found out about the multiple myeloma foundation. So I was very happy to meet Barbara and to volunteer to do whatever I could to help. Thank you.
Good afternoon. I'm Tim Flood. I'm a physician with the State Health Department, and I provide direction for the State Cancer Registry, which is the entity that's tracking the occurrence of new cases of cancer in the state. And myeloma is certainly one of those cancers that we track. And I come at it from the epidemiology background, where we're very much into analysis of the numbers and looking at the burden of the disease. And so I bring that to the table for us to consider.
Thank you. That's very important. Thank you. It's okay.
This fellow here is my husband.
I'm the third.
Yeah. He's a
Friend
retired professor from endocrinology and developmental biology, so he's got a good background in science. But my name is Deborah Stegman, and I am the Vice President and General Manager of CARES Diagnostics. And we're affiliated with also CARES NPI for our convenience operations here. And we have a core business of both GI and DermPath. But just recently, probably about a few weeks ago, we have rolled out hematopathology for flow cytometry, cytogenetics of fish, which is fluorescence in situ hybridization, and also molecular testing. So we have both production of clinical samples and also a division that is in development. So we do see multiple myeloma samples, and my background officially was through as a cytogenetic person, and I worked with Eden Carolyn here for over 20 years, I guess. It's been a long time. So we have a very multidisciplinary institute, but it's all geared towards personalized medicine and patient. So I'm very honored to be here and to be part of this discussion. Thank you.
My name is Carolyn Risky, and I learned about the sport through my son, Kurt Risky, who was adopted by Barbara Kavanaugh.
And she's so kind she lets me borrow.
And no, he's very excited. That was just him calling. I'm sorry, he was lost trying to get here. But anyway, I professionally am a cytogenetic technologist, and multiple myeloma is one of our, it's kind of a tricky disease to try to get into division because it is a mature cell. And so we've always struggled with them, but we're getting better. And I did bring a few things to pass around of a cell that I had that is an abnormal multiple myeloma cell, 1 out of 30. But it's a typical thing that we see when we see multiple myeloma in division. And so I was interested also because my future daughter-in-law's father had a bone marrow transplant in 2000 for multiple myeloma, and he's currently back on Velcade. And I can't think of it, but it starts with an R.
Probably Rebel Man.
That's it. That's it. And so I want to try to be here to learn for support for anyone.
I'm going to be
Listen to
annoying.
what
when
everybody
they
else has
sit
to
up
say.
here. Please, 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 listen.
But it's
Don't
nice to be
understand.
here. It's nice to be included tonight. So.
Thank you. And well, I'm inviting Linda because Linda's a dear friend and also one of the people who's been a tremendous help to us in developing first our tissue donor awareness program.
I just, two things. Someone had mentioned earlier about networking. And so for everybody here, I have a list of everybody with their name, their address, whatever, and everybody's exchanging cards. Is there anyone here who would not want me to give their information out to other people? We're all good with that? Okay, I'll do that. And the other thing that Barbara was saying is about the Tissue Donor Awareness Project, and Deborah and I were kind of talking about this earlier. When I did collection, we need to have people like myself who are on the front lines in the ORs with the surgeons and people who are the investigators to kind of bridge and say, okay, here's what's going on in the OR and why you're not getting stuff. And here the researcher, this is what you need, and it's people like me that have to say, okay, here's the Venn diagram, here's where we are in the center, and this is the objective, and here are the differences, and how can we compromise and bring this closer, or what really is important on this end or this end that can go away so that, you know, we can meet in the center. And so I started to develop with Barbara a slideshow for this. And Linda did a whole bunch of work, and Stephanie Buckholz isn't here. I want to give her some credit. She's from TJ. She did a lot of work on this, and I've kind of been pulling things together and kind of combining things and whatever. I have no ownership over this, so I'd like to send the slides out to you for your input and your refinement, because I don't understand everything from everybody's perspective. But what we're doing with the slideshow is we're having a core slide, because everybody wants to know what is tissue, what do you mean by tissue. But then, you know, there are certain things that administrators need to know about space, about freezers, about liquid nitrogen, those kinds of things. There are things that doctors, the surgeons need to know about, you know, tissue, how long it can be out of the body. You know, can I give you some anatomical information about where it comes from? And then also working with patients, saying this is what we mean by tissue, because from my perspective, I saw a lot of patients saying, well, they're just going to throw it away. Why can't you collect it? Well, it's a little bit more complicated than it's just being thrown away. Somebody has to know how to collect it. It has to be collected under sterile conditions. You know, the pathologist has to use it first for diagnostic. There's a myriad of things. It's just not thrown away tissue. So we need to educate people about what tissue donation is, you know, what are the privacy laws, what are the ramifications down the road, what are the legal aspects. So what I would like to do, since I'm kind of spearheading this for Barbara, is I'd like your permission to contact you and say, okay, here's the slideshow. What do we need? What are we missing? And, you know, please tell me what I can do to make this better. You're not going to hurt my feelings by rearranging it or doing whatever. I welcome that. So I just want to...
I was going to say, it sounds like you have to consider our audiences as well. This may be a community patient, and I see that as we have to educate patients to ask the doctors to save my specimens. You have to get the doctors to then connect to the researchers. And I think what you may be talking about is like, well, maybe considering TDAP too.
Well, that's the one, that's what we're talking about.
Is this professional? Is this professional one?
No, this one's going to be a general community, like the ones we did for 2 years ago.
But we're thinking about expanding it, so there's more for professionals, and I think that's very good.
Well, I have the slides color-coded, like clear is for the community, yellow is for the surgeons, you know, pink is for the pathologists or whatever. So yeah, so I'll give you the color coding, but you're right, there are different audiences.
You might want to even consider, and I'm sure they're already written up